We had studied 1,200 school children, most of which resided in the Mon Valley. All the children resided near point sources of air pollution. If your asthma is not controlled, you're going to be having frequent symptoms, wheezing, coughing, missing school, needing to go to the doctor. Your parents are going to be missing work. We actually teamed up with Dr. Albert Presto from Carnegie Mellon University, who has a mobile monitoring unit. And of those 1,200 students who participated in the study, he was actually able to tell us down to their home address what their annual pollution exposure was. 70% of the kids in this study had annual exposure to PM 2.5 above the World Health Organization limit at the time. And then subsequently, the World Health Organization has decreased that down to 5. Using our validated survey, we found that 22.5% of the children had asthma that had been diagnosed by a physician. The national, state, as well as the county rate of childhood asthma was 8 to 10%. And here we are finding 2 to 3 times the prevalence or the number of children who have asthma. And we found that 60% of the children who knew they had asthma had uncontrolled asthma. Again, meaning that they're sick, they're wheezing, coughing, missing school, they're not sleeping at night, parents are missing work, they're visiting doctors in emergency rooms. Based on state and national numbers, we expected 30% to have asthma that's not controlled. So again, double what you expected. We controlled for a variety of other factors that we know influence asthma, and they weren't playing a role in this case. These children near these point sources of pollution, their asthma outcomes were being driven by the air pollution exposure. This is a second study my group did. We published in 2021. When we were doing the school-based screening, and we're actually seeing how these children, how many children had asthma and how it was impacting them, we started some school-based clinics. And I was running a school-based clinic in the Clairton elementary school at the time. We had come back from Christmas vacation to see the children for their January visit. This was the day we found out via the news that there had been a fire at the Clairton Coke Works on Christmas Eve. That fire had knocked out pollution control equipment. And that equipment was offline for months, almost 100 days. And I saw those children coming in January having asthma attacks and wheezing. And as a pediatric allergy asthma specialist, January is not a time when children flare with asthma. Their peak time to flare is typically in September when they go back to school. And then the other time they flare is April to May with the pollen exposure. So it was quite striking to see that this was happening with these children.